got leaky gut. Oh no, where'd he go? I think he got the leaky gut. Hey guys, welcome back to the channel. Today we're going to talk about some of the symptoms of leaky gut syndrome, and maybe we'll address whether it's really a thing or not, but it's important for us to kind of go over this because a lot of people get confused and misdirected. This is going to be one of the videos that I'm going to do. I'm going to do over 100 videos on leaky gut, so if you're looking for information on leaky gut, this is the channel to be, and let's get started. A lot of people come to me and ask me the question, Doctor, do you think that I have leaky gut? And the answer is almost always, yes, you do. And what does that mean? It means a lot of different things to a lot of different people. Patients come in very concerned about this situation when sometimes it can be a very minor thing. Other times it can be a pretty serious thing to address. So it's important to know if you can differentiate between what are the symptoms of leaky gut and what are the symptoms of something else. The question really comes down to, do you have any digestive symptoms? If you have digestive symptoms, then for sure you have some level of leaky gut. So if you think you have some of the symptoms of leaky gut, so that might be bloating, it might be irregular bowels, it might be loose stools, then hard stools, maybe constipation, diarrhea, or maybe more familiar terms for you, it may be fibromyalgia. It may be brain fog, maybe ADD, ADHD. It could be any of one of these things, and really it can be loss of hair, it can be thyroid issues, it can be liver elevated enzymes on a lab test. There's a lot of signs and symptoms of leaky gut. But the most important thing to know is if you have digestive symptoms, you likely have leaky gut. So let's talk about what I'm defining leaky gut as. If you have any inflammation of the intestines, it's likely that there's some kind of alteration of your intestinal permeability. What that means is that somewhere along the track of your digestion, you may have some inflammation. Where that inflammation is where you're going to find some permeability. What that means is that it's just not as strong as it used to be in that location for whatever reason. What happens when you have leaky gut is you're able to allow outside particles in. It can be food, it can be toxins from infection, and it can be really anything else that goes into that gut lumen. Now, a lot of people are going to ask me, should I take probiotics for my leaky gut? And this is a very controversial question because a lot of people want to talk about how infection is the root cause, how dysbiosis causes a lot of leaky gut. But my suggestion to you is that if you add probiotics to a leaky gut, those probiotics can also pass through this permeable intestine. So before you want to go and add a bunch of probiotics, you want to start healing your leaky gut. So my recommendation is before I would ever add probiotics to a leaky gut is that I would start trying to treat what caused that leaky gut in the first place. And what causes most leaky gut from a functional level, now we're not talking about people who've had severe trauma to their gut. We're talking about the average everyday person that has distension, bloating, discomfort, maybe even vomiting, constant reflux, things like that that go on all the time that no one else really sees, but they're pretty miserable to live with. When you're talking about that kind of quote unquote leaky gut symptom, the last thing I'm going to do in my practice is add a probiotic, right? This is completely opposite of what everyone else says, and that's why I want to bring it to you today. But what I'm going to do is I'm first going to address those infections. And the best way to address those infections is with herbs, in my opinion. Chinese medicine has been using these herbs for centuries, and so what we did in my practice, we adopted a lot of those things. The big telltales that you want to look for is essentially a lot of people come in and they all have an idea of what they might have going on. I want to give you just 4 criteria of certain infections that may give you a better idea of which one you're actually dealing with. So one of the things that I see commonly with parasites, for example, is you're going to find a lot of sharp pains. It'll feel kind of like almost like a bite inside. It'll feel like a stabbing pain and then it will go away. That's a good sign that it might be a parasitic infection. Also, parasites often happen in the evening, so they'll come to life in a full moon evening, and you may feel more symptoms in the evening or lack of sleep or insomnia due to that parasite. Now, on that same insomnia note, we want to talk about funguses. Funguses overburden the liver with all kinds of things. So fungus, or I said funguses, but it's really fungi. Fungi will create a lot of distension. So a lot of people come into my office and they've read an article or two about SIBO, or small intestine bacterial overgrowth, and they think that they have SIBO, but in most cases they actually have small intestine fungal overgrowth or large intestine fungal overgrowth, and that is noted by the distension. So if you're someone, especially females suffer from this, that come into my office and you feel just bloated by more than a couple centimeters, right? So you're talking a couple inches between the beginning of the day and end of the day, or before you eat and after you eat. If you feel significant distension, whether you eat or not, oftentimes that's a fungus. Okay, now viruses are for you people that become intolerant to almost everything. If you have more than one food sensitivity, it's likely that you have some type of hidden virus in your digestive tract that's kind of wrecking problems. Now realize that dysbiosis doesn't mean that you have an active viral infection that's going to take you out. It's nothing like that. It's going to be something that you could live with. Right? We live with a lot of viruses throughout our lives, and they don't really go anywhere, and we often have them, and we can kind of co-live with them or exist with them in harmony without too many side effects. Eventually, sometimes we'll get some of these viruses, though, that create problems in the digestive tract. And when these things are concentrated in the digestive tract, what we find is we start to become intolerant to many, many foods. So if you're one of the many people that's thinking, oh, well, I can't have broccoli, I can't have cabbage, I can't have celery, I can't have apples, I can't have oranges, I can't have whatever other fruit and vegetable and solid food there is, it's likely that you have a low-grade viral infection that's starting to create reactions to multiple foods. This is common in the condition called multiple chemical sensitivities. So you'll find that a lot. And lastly, we'll talk about bacteria. So bacteria is going to be the most common infection associated with reflux. Now, the traditional one we know about is H. pylori. They can often test for that in your traditional doctor's office. But a lot of times there's other bacteria that we don't test for that are causing those typical reflux symptoms. Now, I did not give you every symptom that's associated with a bacteria, with an infection or with leaky gut. But these are just some of them for you to take a look. Maybe a way for you to narrow it down into a more simple pattern so that you can start to get to work. In the other videos that I'll show on my channel, you can find what are my favorite herbs to treat a bacteria. If you're having the reflux, if you're having the bloating that's more, if you feel like you're having more of that stabbing pain, and you've already had these things checked out by a qualified physician, then you can start looking on your own, okay, what can I do on my own? So once again, if you're wondering if you have symptoms of leaky gut, the question goes back to, do you have digestive symptoms? Now, there are a few people that will still have symptoms. The symptoms of their leaky gut will not be correlated to digestion. They might be brain related. They might be neurological related. They could be some other form that the patient is experiencing it in. But in general, you're going to find that most people that have actual leaky gut or intestinal permeability have digestive symptoms. So pay attention to that. And now know, anytime you have digestive symptoms, whether you're just like, oh, my stomach's upset, or I don't feel good after I ate that food, that there's a possibility that you might have leaky gut going on, and it's something that you need to address. Now, it's not something you need to be afraid of. It's not something that can't be cured. There is kind of a level of where a lot of us are going to have constant leaky gut. Or for example, you may find that you kind of go in and out as you try and discover some of the root causes that are causing your leaky gut. But as far as symptoms go, you're looking at traditional gut symptoms: bloating, reflux, irritability of the intestinal lining, loose stools, hard stools, things like that that are very common. And that's what you want to look for. Let me know, are you suffering from leaky gut? If so, what information do you need that I can put on this channel so that you can get yourself better?